Following program is brought to you by Health Initiatives, Innovative Health Solution. For more information, visit us online at ccmhi.org.
I'm Dr. John Evans. I'm an orthopedic surgeon, and I have training in musculoskeletal problems as well as neurosurgical problems. So this is my background. I work with Christian Care, and I work with the Health Initiatives Department. And I wanted to tell you that this group, as well as our nationwide group in Christian Care, I believe should have some specific goals in mind that would relate to the number one principle under which Christians should operate, and that's the principle of love. And I consider this to be something on this order. We begin with love, and on love hangs the two laws, love to your neighbor and love to your God. And then on these two laws hangs the Ten Commandments, all of the Ten Commandments, and then it's fleshed even further out in the Sermon on the Mount. So it's really explained and enlarged and magnified. I believe that God would want me to share with you some concepts that I have relating to the 13th chapter of 1 Corinthians. I think this is a chapter that you ought to read every day and learn that without Christ-like love, all other qualifications are worthless. And so with that in mind, I committed 1 Corinthians 13 to memory, and I used the Phillips translation, and it goes this way. If I speak with the eloquence of men and of angels, but have no love, I become no more than blaring brass or crashing cymbal. If I have the gift of foretelling the future and hold in my mind not only all human knowledge, but the very secrets of God, and if I also have that absolute faith which can move mountains but have no love, I amount to nothing at all. If I dispose of all that I possess, yes, even if I give my own body to be burned but have no love, I achieve precisely nothing. This love of which I speak is slow to lose patience. It looks for a way of being constructive. It is not possessive. It is neither anxious to impress, nor does it cherish inflated ideas of its own importance. Love has good manners and does not pursue selfish advantage. It is not touchy. It does not keep account of evil, nor gloat over the wickedness of other people. On the contrary, it is glad with all good men when truth prevails. Love knows no limit to its endurance, no end to its trust, no fading of its hope. It can outlast anything. It is, in fact, the one thing that still stands when all else has fallen. For if they are prophecies, they will be fulfilled and done with. And if there are tongues, the need for them will disappear. And if there is knowledge, it will be swallowed up in truth. For our knowledge is always incomplete, and our prophecy is always incomplete. And when the complete comes, that is the end of the incomplete. For example, when I was a little child, I thought and felt and spoke like a little child. Now that I am a man, my childish speech and thought and feeling have no further significance for me. At present, we're men looking at puzzling reflections in a mirror. But the time will come when we shall know reality whole and face to face. At present, all I know is a little fraction of the truth. But the time will come when I shall know it as fully as God now knows me. In this life, we have three great lasting qualities: faith, hope, and love. But the greatest of these is love. And I think if we all function on the basis of this kind of love, we can only be beneficial to ourselves and one another. And that's the reason that I present this talk that I've entitled Biological Rust. That's about as close as I can get for a good plumber to know that we're talking about something that blocks or occludes your circulatory system. There's a biblical principle involved, and the biblical principle is this: the life is in the blood. And if you can't get the blood to the tissue, if you can't get the blood to the cells will die. So I've got some bad news for you, and then I have additional bad news for you, and then I have some great news for you. So I'm going to begin with the bad news. In 1953, during the Korean conflict, we autopsied American boys killed in action during that conflict. We found that 80% of the American boys killed in action had appreciable coronary artery disease. And 10% of them had one or more coronary arteries blocked 50% or greater. That means that the blood flow through those partially blocked arteries had diminished significantly. If you diminish the size of a pipe 50%, you not only diminish it 50% in one direction, you diminish it 50% in the other direction, so that the flow through that pipe is not 50%, but only 25%. This means that 10% of the American boys in the fields of battle in Korea, 10% of them were functioning on only 25% of the cardiac reserve that they should have. Only 25% of the blood flow. This is rather tragic. The other side of the coin was that they autopsied Korean boys at the same time, and they found that they had virtually no coronary artery disease. So this would suggest that there's something that the Koreans were doing that we weren't doing, some things that we were doing that they weren't doing, that was producing this significant degree of disease. The bad news gets worse when just a couple of years ago we added another study where we took 2,876 young people between the ages of 15 and 34. These were autopsy specimens. These were kids who were young people who were killed in either homicides, suicides, or motor vehicle accidents, something of that nature, and they autopsied this group. And here's what they found. Every single one of them had some artery disease in the terminal aorta. Every single one, from 15 and older. And they looked, another group looked at a group of kids between 10 and 14, and this group, 50% of them had artery disease in their terminal aorta. So it appears that the terminal aorta is the area where the disease really begins, but it goes quickly to the coronary arteries. Now, in order for you to get a good picture of this, I want to have you look at this slide on the screen. I've left it on the screen for this period of time for two reasons. One, I'd like for you to see what near normal means. This is not normal. This is the abdominal aorta of an 18-year-old boy who was killed in a Kawasaki accident. I couldn't find any artery more normal than this one. This one is not normal. It has streaks going down the artery that are the beginning of atherosclerosis. But the thing I wanted you to see in this slide is that there are openings here at the back of the artery, which are the openings to the blood vessels that go to the back and the thoracic and abdominal cavities. Those arteries, not only do they supply the vertebral bodies, but the intervertebral discs, they supply the tissues all throughout the musculoskeletal system in that area. And I want you to get this picture well in mind when you go to the next slide, which is going to show you the far end of the disease process. Now, what you're looking at here, at this point, the heart belongs right in this area. This is the arch of the aorta going through the thoracic cage, and this is where it breaks off and goes through the abdominal cavity and goes on down to the common iliac vessels on both sides. What you notice here is tremendous blockage of all of the intercostal arteries that we had seen on the previous slide. Also notice up here at this portion of the slide, these are the two arteries that go to your brain. This is not a very good picture. Also notice that there's calcification in the wall of the artery. This calcification is present because of the disease process that atherosclerosis produces. I consider calcification to be something like tombstone markers for damaged cells. In this area you see cholesterol and triglyceride plaques all through here that have not only totally occluded and obliterated the small vessels that we saw on the previous slide, but there are clots behind these plaques that are present. These clots are caused by the swirling of blood behind the plaques that are here in the wall of the artery. If you were to take a Q-tip and just take a vial of blood and swirl the Q-tip in the blood would quickly clot on the Q-tip. And this is what happens in an area like this where you see clot behind this plaque. This is not a very good picture. The next slide will show you what this individual's heart looked like. What I want you to see, it's been sliced. There have been slices already in the heart, but you see these are the coronary arteries right here that supply the blood to the heart muscle itself. The blood that goes through the heart does not supply the heart. The blood that goes out of the heart through the arch of the aorta turns and goes through coronary arteries that are on the surface of the heart right here. The next slide is going to show you a blood clot in this coronary artery. This is the clot that did this patient in. Notice a huge amount of fat on the outside of the heart, but there's significant fat and occlusion on the inside. The next slide will show you the left coronary artery and then the right coronary artery. The left coronary comes down and divides into the circumflex, the anterior descending. And what I want you to see, there is a blockage right at this bifurcation or this division. And this blockage causes this anterior descending to be totally occluded down to this point. This A that you see on anterior descending, this A is an average size typewriter A, and that gives you an idea of the size of these arteries. They're not very big, but they supply the heart. The next slide will show a close-up of this anterior descending, and you see the blockage here, here, and here, as well as here. The coronary artery surgeons will take a blood vessel and bypass, go from the arch of the aorta over to this bypass, and then try to sew that artery, that vein graft into this artery here. My hat's off to those guys, because it's somewhat like putting sutures in a patty of butter, if you look at that. The next slide will show you the right coronary artery. This is a different individual. I use it because I believe that it shows what might help you see what goes into the formation of this type of disease process. If you put a breakfast plate under this right here, most people will see 2 eggs and a slice of bacon. Notice the fat layer from here out to here. This is all outside of the artery, but the fat inside of the artery, this is a cross-section of the artery right here. The fat inside of the artery has led to this occlusion. This is the clot that ended up destroying this particular individual. And the next slide just to show you that the problem is not limited to the heart. This is the base of the brain. This is the entire brain. You're looking at the bottom of the brain as though you were looking from underneath the brain up. This is the fore part of the brain here. This is the cerebellum, the part that allows you to have good equilibrium. And right in this area you will see the optic chiasm. That's the nerve that goes to your eye. This is one of the nerves that goes to one eye, the other nerve goes to the other eye. But inside of this you see the circle of Willis. The circle of Willis is composed of 3 arteries. You have 2 carotid arteries that go in your neck and a pair of vertebral arteries in the back that go up to connect to become a basilar artery. And those 3 arteries go to the base of the brain. And what you see right here is an aneurysm in the circle of Willis. These little worm-like creatures here are the olfactory nerves that help you smell, your sense of smell. But the next slide will show you a close-up of this aneurysm. It wouldn't take very much for that aneurysm to rupture, and if it did, this side of the brain would go dead. You would have a stroke. You would be dragging the opposite side of your arm and your leg. That part of your body would just be something that you drag along, something that you don't really want to have. The next slide is a slide that the pathologist did for me. We're still with the same individual, K.E., and here is that huge aneurysm in the circle of Willis. The circle should really be a circle, but right here it looks like a square. Not a circle, but a square. This is one of your carotid arteries, the other carotid artery, and down in this area is the basilar artery that comes from the 2 vertebral arteries that come up the back of your spine. Now, if you go from the basilar artery, you could imagine in that second slide what the inside of this artery looks like. It is filled with cholesterol plaques and triglyceride plaques. If you get up to this area, this communicating vessel right here has shriveled up and is of no value. It will not communicate any blood. This communicating vessel here is in the same condition. It has gradually lost its ability to carry blood, and it will not carry blood. Ordinarily, when you have a situation such as an aneurysm like this, it's just a rottening bit of artery right here. This rottening bit of artery has a clot in it, inside of it, not fully clotted off, but it has clot in it. And if you did not have the loss of these communicating vessels, you could put a clamp on this portion and a clamp on this portion of the aneurysm, and it would not rupture. And you would still have circulation coming from the basilar up through the communicating and then over to this section of your brain. However, since this is not patent and this is not patent, you could not clip this aneurysm. Notice the KE, it's the same person that we've seen from the beginning. So it involves everything. The arterial system damage involves the entire system. Now the blood pressure has to be elevated to get blood out to these peripheral vessels. But as the blood pressure goes up in the basilar artery, it lays down more and more plaque in the artery. When you get out to here, you see almost normal arteries. When you get to this section, these arteries allow you to see the blue of the drape from behind it. And it should be semi-transparent. But in this basilar artery, you see it's totally opaque. In this artery to the right, you can see what looks like balls of cholesterol and triglyceride inside the artery, inside this semi-transparent artery. Now keep this in mind as you look at the next slide, because this is a fellow who's a Floridian. Ralph has what looks like a clear blue eye on the left and something inside the eye on the right. That something inside the eye is cholesterol and triglyceride accumulations within the eye. I saw this first in the Journal of the American Medical Association, and I wrote the ophthalmologist who took the slides, and I asked him to keep me posted. Well, he did. This material here ordinarily is only in an arc fashion, like this. But instead, this one goes all the way around. So this was called initially Arcus Senilis. The type of thing that you saw in a senile or elderly individual, you never saw it in anybody that was young. But now we see it in younger and younger and younger people because of the problems associated with atherosclerosis. Now, we waited until Ralph passed, and we looked at the arteries that supply his eyes. And the next slide shows you what these arteries look like. These are the ophthalmic arteries. It should be this big, right out to this rim. On the right side, it's blocked to this degree, but there's still a fair amount of blood that will flow to that eye so that he could continue to lay down plaque in his eye itself. On this side, you see it dramatically decreased. Just a trickle of blood can go around this huge iceberg of cholesterol and triglyceride in this left ophthalmic artery. So what you're looking at is an early loss of blood flow to the left eye, the eye that looked the best, the prettiest, bluest eye. This eye looked the best, but you can see that the disease process is even more dramatic on the left than on the right. Can you see that? And when you go home, you can look in the mirror and see where you stand as far as Arcus Senilis is concerned. It's a late thing for most people. So when you look in your eye, if you see it, that's not a good sign. If you don't see it, it's not necessarily a good sign. The disease process is occurring on the basis of the studies that we've looked at, where by the time you're 15, virtually everybody has some artery disease. I'm several years beyond that, and I'm quite confident that I have some artery disease. I want to do all in my power to avoid the progression of the disease. Now, that's the bad news. And the good news is that in 1990, a young physician on the West Coast by the name of Dean Ornish took 48 patients who had known coronary artery disease. He divided them into two groups. These were people who had already had heart attacks, who had known coronary artery disease, had angiograms, had all the evidence that we needed to be certain that they had significant artery disease. He divided these into two groups. He took 28 patients in one group and 20 patients in the other group. Those on the 20 of them, he put on the American Heart Association's diet. And the other 28 he put on a total plant-based diet. Now, up until this time, there had never been ever any proof that lifestyle could change, stop artery disease progress, or reverse it. There had never been anything of this nature done until Dr. Ornish came on the scene. What he did a very expensive test known as a PET scan. A PET scan is a specific type of scan that looks into the arteries without being invasive and allows you to accurately assess the artery itself. And so they did PET scans on all of these people. Now, in 1990, a PET scan cost about $1,500. I don't know what it costs today, but I'm certain that it's not less than $1,500. But at any rate, it was an expensive test that he did on all 48 people at the beginning of the study. At the end of the study, here's what he found. he found that those on the American Heart Association's diet had increased their artery disease by 2% in 1 year on a good diet, a better diet than most Americans are on. But then he found something unbelievably dramatic. On lifestyle alone, they were able to decrease the artery disease by 5% in 1 year. So the difference between a good diet and a better diet had decreased the artery disease a difference of 7%. 7%. And 1 year, not many years. This really startled the medical community, because up until this time, the only thing that had ever worked in lowering the artery disease was drugs. And Dr. Ornish decided that he wanted to put it to the test, and he showed that by lifestyle alone, you could not only stop the artery disease, but reverse the artery disease. Pretty impressive. Last week in the journal, the Annals of Internal Medicine, we discovered that you might be able to even further reduce your cholesterol over a typical low-fat diet by adding lots of, guess what, fruits and vegetables. In the study that they just completed, described in the Annals of Internal Medicine, they found that you could put people on a low-fat diet, still allow them to have their sweets and goodies, and you would lower their cholesterol a degree. But if you added significant quantities of fruits and vegetables, you're adding back something that's missing from the diet. You put it back in, and you can double the lowering effect of a low-fat diet. Do you have any questions? Yes.
Does the reversal process slow down after a year, or has anybody followed that up with a longer term study?
Yes, Dr. Ornish followed this up with a 5-year study, and it continues to diminish the plaques inside of the arteries, but not at the degree that it did that first year. Yes.
Do you have a copy of that diet that he put those other people on that reduced by 7%?
Well, it really isn't a very complicated thing. What it is a diet that is composed of fruits, vegetables, whole grain breads, and cereals, and removing animal products such as eggs, cheese, beef, pork, and poultry, even fish, on the diet that Dr. Ornish prescribed. He allowed skim milk products to get the inadequate source of B12. Yes?
What about soy as a meat substitute, or is it better to just avoid it altogether?
Soy is known to be valuable in lowering cholesterol. I suppose one of the things that I didn't really mention to you is the sources of the cholesterol. The sources of the development of the cholesterol is basically eggs, cheese, beef, pork, poultry. Those are the sources, primarily animal products of the cholesterol. But the triglycerides, which is indistinguishable in the gross specimen, it comes primarily from alcohol, sweets, and body fat. So you can produce the triglycerides from those items. So by removing those items from your diet, then you can further decrease the triglyceride components. Yes?
Comparing the Korean War soldiers, I mean, they're on a pretty clean diet compared to our current stuff, aren't they?
In 1953, I would judge that it was better than today, because today we have not only the saturated fats, but we have the trans fats. We have so many pre-prepared foods that complicate the issue today. And then we have the current problem of a significant, dramatic increase in obesity. So we're looking at things coming to a point where the disease process may be exacerbated. In 90, you know that the changes really began in World War II. Prior to this, you know, people ate out of their garden or out of their orchard, and as they said, cooked from scratch. But between World War II and the Korean conflict, there was some dramatic changes in the way food was prepared and processed. The Korean boys, one of the things about the Korean boys that shows that a spare diet is valuable, and vegetables, they were primarily on rice and vegetables and some fish. And yet their arteries were dramatically cleaner than our American boys. Yes?
So on that study, what was the average age of those boys?
The average age of the boys in the Korean conflict was 22. Yeah, so we're talking about, and 80% of them had appreciable coronary artery disease with an average age of 22. They were 18 to 26, average age 22. So a Dr. Holman in New Orleans in the early 50s was probably one of the first people, and he was a pathologist, was one of the first people to recognize the early onset of atherosclerosis. And he antedated the study of 1953. He was showing at that time that looking at children in New Orleans, and New Orleans is a hotbed for atherosclerosis. There's a lot more atherosclerosis in New Orleans area than in other areas. But they've taken the children in those areas. Dr. Holman began the project prior to 1953. And he simply saw it in children who were killed in accidents. Under the age of 15, down to 10.
So the result of a high protein, the long range result, like the Atkins concept, is?
Dr. Atkins certainly has not done us a favor. He has demonstrated a method by dramatically cutting calories and having an individual satisfied because of the high protein, high fat diet. He could cut weight, but the long-term effect of this is lots of colon disorders because of the dramatic slowing in the transit time of fecal material going through the tract, increase in polyps and hemorrhoids and cancer of the colon, gallbladder disease. All of these things are increased by this diet to try to lower weight. It does lower weight, but I've talked to any number of people who have been intermittently on the Atkins diet, and they just go from up and down and up and down, and they believe now that going up and down is worse than staying heavy. It probably is, because it damages the arteries even further. So the Atkins program, I think, was a treacherous, unfortunate experience. We've lost members of Christian Care who were on Atkins, who had massive heart attacks while on Atkins, while losing weight. Yes?
I know dietary changes are strongly recommended. How about exercise, the role of exercise?
Exercise is vitally important. If you want to lose weight, the key to losing weight is a dramatic increase in your cooked dark green leafy vegetables. If you do that, you're filling your stomach with something that occupies a lot of space and is very low in calories, and takes a significant amount of time to digest. So you're not hungry quickly. But if you want to get in the best condition, obviously you must add a good exercise program to your dietary changes. And of course, people who smoke, that's the most important thing for them to do, is to stop smoking, because smoking is worse than any of the other things that we've discussed. Yes?
I know you're an advocate of plant-based diets. What are the adverse effects of eating, say, chicken and fish? How does that affect coronary disease?
The question is, how does chicken and fish rate to beef and pork? And this is your question, basically?
I mean, in terms of the impact on...
On the artery disease? Yes. Dr. Ornish felt that in his study, the study that he did, that any use of animal products other than skim milk products would not do what his study has proven could be done. Everything is relative. And so if you look at relativity, fish is definitely superior to poultry. Fish is dramatically superior to poultry. And then poultry is a significant step down. And then, of course, beef and pork are much worse. So, if any progress that you can make in the direction of a plant-based diet is to your advantage. But now with the article that is in the Annals of Internal Medicine last week, we know that what you must do is eat plenty of fruits and vegetables. Now, if you're eating plenty of fruits and vegetables, your desire for the other things is going to gradually diminish, and you will have the advantage of reversing your artery disease. Thank you very much.